Mr. President.
Democrat Whip.
Mr. President, the senator from Wyoming is a friend of mine, really. And though we may disagree on some political issues, I greatly respect him and glad to call him a colleague. But we do disagree on this point that he just made, and it's a very important disagreement because it affects every family in America. The decision was made in the big, beautiful budget bill by Donald Trump to cut $1 trillion out of Medicaid. Medicaid is a program which helps people who have limited income have health insurance. It also takes care of your mother and grandmother when they're in the nursing home. It's a critical element of funding health care in America. And the Republicans cut $1 trillion out of it. If you go to the hospitals in Illinois, some of them are great hospitals, others do great things, but you'll find that the hospitals that struggle to survive are ones that have more Medicaid patients than paying insurance patients. It's tougher margin, and many of them worry about it. And the notion of cutting $1 trillion out of this program worries them. Don't take my word for it. Ask the Illinois Hospital Association, or even if there is one, I'm sure there is, Wyoming Hospital Association, what the impact of cutting $1 trillion out of Medicaid reimbursement is going to be. Not good, particularly in rural areas. Senator Barrasso made reference to his situation in Wyoming. In the state of Illinois, we have plenty of these rural hospitals, and if one closes, it means your pregnant wife who goes into labor now has to drive 70 miles instead of 20 for that delivery. I'd hate to have to go through that. And yet that's what's going to happen. And so the position we're taking is that that kind of cut in Medicaid is going to hurt hospitals and hurt people across America. Secondly, there is a tax credit available for people in middle-income categories to buy health insurance. It's part of the Affordable Care Act, which was the Barack Obama plan that extended more health insurance coverage to America than we ever had in our history. How important is health insurance to you? I had a personal experience as a law student at Georgetown. I decided that I couldn't wait, and I asked a young lady to marry me, and she did. In my second year in law school, we learned that God was sending us a little baby. And we were so happy about it, and she arrived with her share of difficulties. I had no health insurance, none. What do you do as a student with a wife and the baby's sick when you have no health insurance? Well, Children's Hospital here in Washington, D.C. brought us into the so-called charity ward, and we waited to see who would walk through the door with the name Dr. So-and-so to take care of my daughter. I never felt more inadequate in my life as a father and a husband and not having health insurance. We got through it, she got through it too, and lived a good life. But the point was, there were moments when I worried that I couldn't provide the basics for my baby because I didn't have health insurance. 15 million Americans will lose their health insurance because of this Republican budget that I just referred to, the big, beautiful budget. 15 million will lose health insurance. I wouldn't wish that on anybody. So when the Democrats say there are health care issues that are part of this debate on funding the government, that's what we're talking about. Keeping these hospitals open, critical hospitals in inner city as well in rural areas, making sure that people have their health insurance. And there's one third element I would add. I don't think we'll be able to negotiate it. Medical research. Ever hear of the National Institutes of Health? Why, sure you have. It's the best medical research agency of any government in the world. I went to the NIH about 12 years ago and met with Dr. Francis Collins, an amazing man who is head of the NIH. And I said to him, I really believe in what you do. Your research in cancer and heart disease and so many other things makes a difference. What can I do to help you? Well, he said, thank you for asking. There have been some people who've done remarkable things. I said, oh, I remember there was a bipartisan coalition a few years back that doubled the budget in medical research for NIH. I said, I wish I could say I could do that again, but I don't think I can. What can I do? He said, give me and this agency 5% real growth each year in medical research, and we'll light up the scoreboard. We are so close finding cures and new drugs in so many areas that if you can give us consistent research, it'll make a difference. Came back to the Senate, sat down with my friends on both sides of the aisle. Roy Blunt, Republican senator from Missouri, was a leader in this effort. Lamar Alexander, Republican senator from Tennessee, another leader. Patty Murray, still serving as head of the Appropriations Committee and one of the best when it comes to medical research. We put our heads together, and over a span of 10 years, the budget for NIH medical research went from $30 billion to $48 billion. We got the 5% coming every single year. It was quite an achievement. 60% increase in that budget. Things were happening, good news, good developments when it came to cures and treatments. I was so proud of that effort and glad that it was bipartisan from the start. So what did the Trump budget suggest we do with medical research? Cut it back from $48 billion to $30, where we started 10 years ago. You know what happens when you cut back on research that basic? You know what happens, and I do too. When that terrible diagnosis happens at the doctor's office, it breaks your heart, and you finally stop crying and you say to the doctor, is there anything you can do? Is there a surgery, a medicine, anything you can do for someone I love very much? They say, well, there's a clinical trial. There's medical research underway, and it's a long shot, but you got a chance. It's hope. Medical research is hope. And it's one of the areas where I think Donald Trump's cuts are the most heartless cuts of all. Democrats care about this. I do. I'm willing to fight over it. I'm not willing to say, well, we'll just go on business as usual. Let's accept this. Let's cut back $1 trillion out of Medicaid. Let's take 15 million Americans and take away their health insurance. Let's cut back $18 billion in medical research each year, and we'll say it's just a clean, continuing resolution bill. That's what we're fighting over. Is it important? For me, it's one of the most important things we can do in terms of helping families across America. And let me tell you something that's going on. You should know about it. You will soon if you're covered by it. Health insurance has tax treatment that helps you pay the premiums. It makes a dramatic difference. And now, in a matter of days, health insurance companies are going to announce what the new premiums are going to be because of the budget bill, the big, beautiful budget bill of President Trump. They're going to go up dramatically. And as these premiums go up, some people won't be able to pay for them, and they'll be without health insurance, and others will see their family budget explode with an increased health insurance premium. That's the reality of this debate. It's not about who gets bragging rights and gets to beat on their chest, a Democrat or Republican. In my mind, it's a question of whether families across this country can count on us for the basics. And making sure that health care is there for America is one of the basics as far as I'm concerned.